My research focuses on the development of AI tools for the use in the diagnosis and management of ovarian cancer. So ovarian cancer is, despite its relatively low incidence, it's the most common cause of death from gynecological cancer worldwide. And in the UK, there are about 7,400 new cases diagnosed each year. And unfortunately, lots of those cases are diagnosed in an advanced stage where the outlook for the women, unfortunately, is quite poor. The work that I'm focused on is seeking to develop tools which can replicate the performance of a really expert ovarian cancer specialist radiologist and kind of democratize access to those tools. So kind of leading to a situation where people aren't dependent on maybe having a very specialist radiologist at the center where they present, but rather with the use of these tools, anyone potentially can have access to those expert clinicians. Patients are really fundamentally involved in our research. So from the very start of the project, it was our goal to really understand how patients felt about the tools we were developing. And we realized actually that while we were investing huge amounts of time and lots of money as well into the development of the tools, and we were hopeful that we were going to have a really good outcome in terms of something that worked really well by the end of it, we realized we actually hadn't talked a lot to patients about how they felt about what we were working on. And given the unease, perhaps, or suspicion sometimes that people can have about AI, we knew that it might actually potentially be a hard sell if we produce really good tools, but actually patients don't trust them. And therefore, kind of our efforts would count for naught. So from kind of then on, we sought to really involve patients very closely in what we were doing and try and understand how they felt about the tools we were developing. And that started initially as a collaboration with the PPI panel in Addenbrooke's, who are a group of expert patients who've gone through a disease and been treated at the hospital. And they give feedback on research projects. And so we involved them and they gave us some really fabulous feedback, fabulous in a constructive sense, gave us things that we could work on. And on the basis of their feedback, we actually decided to conduct this deeper qualitative interview project. We're hoping to interview about 15 patients, and that process will involve us kind of delving into great depth into how they were diagnosed with ovarian cancer and their experience of the pathway, talking to them about the tools that we are trying to develop and how they would feel about those. The key goal, which has been reminded to us by the PPI panel, is that we have to involve patients from the get-go. And we're kind of, I suppose, forever indebted to that panel and the patients that we've spoken to in our interviews, because their giving of themselves makes our research more valuable. And it's really focused on what patients want. Very, very grateful to the patients who we've had involved.